Gives families in Kentucky who are dealing with a loved one who has a mental illness a whole lot of hope.
The new Kentucky law tonight that changes the way Kentuckians with the most severe mental health challenges get the treatment that they need. It is a bipartisan new Kentucky law, and it goes into effect in just a few weeks from now. Psychologists believe it could help turn people's lives around. Lawmakers say it'll keep both families and the public safer. Our political reporter, Isaiah Kim Martinez, has the story.
He was never a danger to anybody else, but she was afraid he was, would never take his medication.
She's watched parents make some of the toughest decisions you'll ever hear.
So he was really a danger to himself in terms of his physical and mental health.
Sheila Schuster describes a case of a Kentucky mom having to call authorities 37 different times to put her own son, who's mentally ill, in handcuffs because of the risk he posed to his own well-being.
And it was the only way that she knew to get treatment for him because he wouldn't cooperate.
Schuster is a longtime clinical psychologist. She's worked for years with lawmakers in Frankfort to pass policies that give mental health professionals more tools to help people who require the most specialized care. One of the latest examples is Senate Bill 122, now law, which goes into effect on July 15th.
When we've got the person, let's make sure they're getting what they need.
The law reforms the process where adults with the most severe kinds of mental illness are committed against their will. It creates a tighter tracking process where judges and mental health professionals have more authority to mandate treatment and check-ins, no matter if that person stays in a psychiatric unit or not.
Then you have a whole lot more eyes on that person to make sure that that happens.
An involuntary hospitalization requires extensive mental health evaluations that show a person is a danger to themselves or others and can benefit from treatment. But Schuster points to one problem: consistent medication plans often falling through the cracks, at times because that same person is suddenly determined to not meet the criteria anymore.
And then the person is there for 3 days and then they're back and then nothing happens. And then you've got this repeated pattern.
The measure got bipartisan support. Republican State Representative Chris Lewis of Louisville believes it'll improve public safety.
Judges now have real options beyond simply hospitalizing or releasing a patient, and mandatory outpatient treatment is now enforceable.
We're told the intention is to avoid the most heartbreaking scenarios and lift up Kentucky families who need the most support. Isaiah Kim Martinez, WHAS 11 on your side.
And again, this law is going to take effect next month on July 15th.